Well, again, welcome to AreaKnows.com. We are just so thankful and blessed to welcome today Kelley, talk about health insurance. Clay is the CEO of Rush Human Resources. He is a distinguished professional in human resources. He has a tremendous amount of experience. I've had the pleasure of working with him in the past. So we're just going to dive right in. Clay, welcome to Ask the Expert, and thank you for being on.
Well, thank you, Red. I'm happy to be here.
Well, what I'd like to do for our viewers, if you haven't watched before, we're going to try to focus on various topics that relate to small business and not just industrial area, but small business. So Clay, what I'd like to do in this particular interview, if we can, just kind of start high level, and then we'll try to drill it down with our last question, simply being what's the most important thing we can do. But help us kind of start it from a high level standpoint. Is Obamacare the same? The term that I've always heard used is Obamacare. Is that the same thing as the Affordable Care Act? And then what exactly is the Affordable Care Act?
Well, and first of all, again, thanks for having me on. And what I'd really like to do is make sure that we dispel the rhetoric of what the Affordable Care Act is. The Affordable Care Act is actually the Patient Protection and Affordable Care Act, and it's also known as Obamacare, and that it is a law that President Obama signed into effect. It's passed by Congress. And its original passage, the actual law itself.
Oh my God!
2,407 pages, and I kid you not. This is the actual law. It requires that every American has health insurance or pay a tax. That's it in its simplest form. Certainly, there's been a tremendous amount of debate about the law. There's been a tremendous amount of publicity about the law. But at the end of the day, there's going to be people with any passage of any act from Congress. There's going to be people that are going to benefit from the law, and there's going to be people that are going to be penalized because of the law. And it's certainly going to create burden on employers. That's indisputed. The next thing I would say is that it really, at the end of the day, it's really about health insurance company reform more than it is about insurance or health care reform.
Well, I'm glad you said that, because I think that's important. The purpose of this interview is to cut through the BS on the news. And so there's a lot of rhetoric out there, and I think some of it is probably justified. But we really want to let's stick to the facts. And so I appreciate you saying that, and appreciate you being able to cut through some of that. So you said it's gonna be a harm. The employers are going to suffer some burden on this. Who actually benefits? And in one nutshell, who benefits from this law?
Well, who benefits are people that are uninsured, or people that are underinsured or uninsurable. Probably that's the biggest thing. The people that are uninsurable, that prior to the passage of the Affordable Care Act would not be able to get insurance without going to a state high-risk pool.
Can you give an example? Can you give oh, you're about to probably. Give an example of what you mean by uninsurable.
Well, somebody that has a condition that an insurance company is not going to provide coverage to, they would decline to offer coverage.
Okay.
Now, what is confusing to a lot of people is that there was a law that was passed a few years back called the Health Insurance Portability and Accountability Act, and that also provided various exclusions that didn't allow insurance companies to exclude certain individuals, children, adopted children, conditions in terms of pregnancy. So those were all taken care of. And that was actually Clinton's answer, if you will, to what Obama and Congress has passed with the Affordable Care Act. So the people that will benefit from the Affordable Care Act, quite frankly, are going to be those that weren't capable of getting insurance in the standard markets anyway.
Okay. I've heard a lot of, and we've had several questions regarding this. You hear a lot about exchanges. Can you tell me, in summary, what is an exchange, and then how does that work with the Affordable Care Act?
Well, the exchange is just a fancy word for marketplace. It's literally the ability to go and purchase insurance. All right, so there's really three different types of exchanges, Rhett. There's the federal exchange, there's the state exchange, and there's a private exchange.
Okay.
The federal exchange is just exactly that. It was created for those states that said, we're just going to refuse to put a state exchange together. And so the federal exchange comes in and runs, if you will, the state exchange. So in Texas, for instance, where you and I both live, our governor, Governor Perry, decided that he would not institute a state exchange. And so federal law came in and basically created the state exchange. Then there is the private exchange. Private exchange is where you have two or more carriers that are offered with multiple plan designs. And so by definition, that is a private exchange.
Okay. And so to kind of just the operational side of this, and let's get back to the small business. So as an employer, if you were going to sign up for the Affordable Care Act, so do your employees go to these exchanges to set up their insurance? They go through you to set up the insurance? Is the purpose of that exchange to kind of pull people together? Explain that a little bit.
Well, the purpose of the exchange is to be able to provide insurance and provide a tremendous amount of regulations. You know, in showing you this bill, the purpose of this was just to let you know the enormity of this thing.
Sure.
It's incredibly complex, and I do need to say that anything that we talk about is pretty much good for today only, and that's not rhetoric. I mean, we had the resignation of Kathleen Silbilius yesterday. I mean, she was the one that was responsible for the implementation of this act through the main enforcement agency or the main regulatory body, which is Health and Human Services. And so at the end of the day, as an employer, you either offer health insurance coverage to your employees or you don't offer health insurance coverage to your employees.
Right.
If you do offer health insurance coverage, then you're getting that coverage through Aetna or Humana or any number of carriers at Blue Cross Blue Shield, Cigna, any number of carriers. Of course, health insurance is very geographically sensitive.
Right.
As it relates to a company that is smaller, that does not perhaps offer health insurance, then the employees have the right under the law to go to the exchange. The other thing about the exchanges is that certain individuals, based on income, have the ability to get what's called premium subsidies. And so you can, depending on your income level, you have the ability to go to the exchange, go to the website, sign up or enroll in coverage, and at that point in time, be able to determine what your premium subsidy would be if there is a premium if you do qualify for a premium subsidy.
Okay. So, and to kind of bring it back home, and like you said, I appreciate you showing us that book. I mean, it's clearly a complicated matter, but so again, the idea is to get people that don't have insurance. So, if you had a small business and you didn't offer that insurance, that is small. The way I've understood it, that company could be subject to a penalty. Is that correct? Or if you are that small and then you encourage your employees to actually go and get on this exchange to get the insurance, are they still penalized even if they walk them through the process? Or talk about the penalty, I guess.
Okay. Well, first of all, the employer mandate. As you know, there's been a number of delays. The employer mandate was first at 50 employees, and it was supposed to go into effect at the beginning of this year. are actually at your renewal. By the way, most of the provisions of the law are basically time-based for your particular group insurance renewal or the open enrollment period in the exchange. So the mandate, the employer mandate, was supposed to go into effect for companies that employ 50 employees or more,
Okay.
was supposed to go into effect January 1st of this year for all of the plan. If you renewed on February 1st, then it would go into effect for you on February 1st.
We said this year, you're talking about you're talking about 2014, correct?
Correct.
Okay.
That mandate was delayed, and it takes effect in 2015, and it's and again, this is I want to dispel the rhetoric, but the issue is you have a gargantuan law that impacts every single American and every American employer in some way, and you have multiple enforcement agencies. You have Health and Human Services, you have the IRS, you have Treasury, you have state governments. I mean, that's if this wasn't so serious, it would be almost comical. But that's the issue. The issue is that there's constant change that has been going on with this thing, and that's what makes it, again, so confusing for a lot of people. You have these delays, you have these implementations, you have these changes. Under the law, I'll give you for instance, under the law, it says that if you can't discriminate on highly compensated employees. Those are what we call a management carve-out. So if you have a company, but you had a tremendous amount of part-time workers that wouldn't be able to qualify, but you just wanted to cover your senior management, your ownership group. Well, the law actually prohibits that now.
Okay.
And they basically said you can't do that, and the law said the IRS is the enforcement agency on this. And the IRS basically put out a ruling or an administrative rule that said, okay, we understand that the law says that you can't do this, but we don't have the ability to enforce that.
Right.
So the unfortunate thing is that this thing has been implemented or attempted to be implemented very, very quickly for a law of this size with multiple enforcement agencies, and they just are not talking to each other.
Okay. So we've had, I know a lot of the rhetoric right now is on the website implementation, stuff like that. And I'd like to keep it more to some of the questions that we've had come in. I think one of the biggest things that we've seen as far as feedback from our members and stuff is, if you kind of had to boil that, and I hate to put you on the spot here, it's a 2,500 page document or whatever. If you had to boil it down to say three things, if that's even possible, as of today, what does an employer have to do today, to kind of meet as many of the, if you could give me three things, or give me 12 if you want, but let's try to help our small business owners. Give me a couple of things that if they're not doing anything else, just from sheer overwhelming, give me a couple of things they need to be doing.
Okay. Well, the first thing is that you have to have a plan description of your benefits, and that plan description has to be it has to be in a template that's been authorized by the Department of Labor and Health and Human Services. That's something that you have to do.
Can you get that template off one of those websites or something like that?
Yes, you can.
Okay. We'll post a link to that website in the thread when we put this up. So if there are links, we'll try to put that down for our members that make that a little easier. So plan description of benefits, it's authorized, and we'll give a link to that. What's a couple more?
The second thing is if you have over 50 employees, you're going to be subject to this law, and you need to seek expert advice on dealing with this law. The other thing is that regardless, if you are offering a health insurance plan, you now have to, on the employee's W-2, you have to record the amount of premiums that you paid on behalf of the employee on their W-2.
Okay.
This is a check and balance mechanism for the IRS to be able to determine whether or not you're offering coverage or not. The third thing that I would say is if you're less than 50 employees, you're not as subject to the provisions yet. There will be a number of changes, but I would encourage anyone to go ahead and look at the exchange just so you see and you know how it works. Go online to healthcare.gov, and then you can put in your particular state. You really should go through that exercise just to see how it works.
Okay.
Again, less than 50 employees. If you like your health insurance plan, certainly there's been changes to your health insurance plans, but you should seek competent counsel with your insurance agent or through an HR professional.
Because if you're less than 50, you're not necessarily, because it is a law for everybody. So if you're less than 50, you're not, and correct me if I'm wrong, but are you just completely immune to it today, or are there still things that's being left at less than 50? There's still some stuff that you need to be following.
There's still stuff that you have to follow.
Okay.
I mean, as I mentioned to you, you've got to do the summary plan description. You have to do, you have to let your employees know that they are eligible to go to the exchange if they want to. That's regardless of whether you have a plan or not, whether or not you have 50 employees. Those are two key things. The other thing is that if you have in excess of 50 employees, it becomes much more cumbersome if you are determining whether or not you should pay for health insurance or have health insurance, or you're covering a few people on your plan and not everybody on your plan.
Okay.
The other thing is that you need to be looking at multiple plan designs. If you're looking at reducing costs, you need to look at high deductible plans and health insurance reimbursement accounts or health insurance savings accounts, things of that nature, to be able to lower your premiums.
Okay, that's good to know. One thing that one more quick question, then I know we'll let you go. Talk about the open enrollment period. I saw just kind of on the news or whatever that was March 31st. Correct me if I'm wrong. Does that mean that now that open enrollment period is done, can you not sign up until January 1st of next year? Or talk about the open enrollment period that you hear so much about on TV right now.
Well, the open enrollment period, quite frankly, and you know, again, this is subject to change, so I'm a little bit hesitant of putting out there about dates.
Sure.
So if you'll excuse me on that, but here's what we know. Is that there was an open enrollment period. That was a deadline, and we're all deadline driven. April 15th, tax day, and all that. The bottom line is that they had to say, you got to sign up by such and such date, or you're not going to be able to take advantage of this for a period of time.
Right. And
so that's why there was such a push to be able to get participants in the plan. See, the plan is only as good, quite frankly, as the participants that are in the plan that are paying premiums. And so there was a huge push, as you probably heard, to get younger people into the plan, and quite frankly, the younger people to pay for those premiums to be able to offset the expenses for an older person that would be signing up. I mean, that's insurance economics 101. The problem is that too many young people, the penalty is not great enough to offset the premium that they would pay. And so time will tell as to whether or not the plan is going to be fiscally balanced. I have my own opinion that that's going to be difficult because unless you really, really needed the insurance, chances are you're not going to buy it.
Right. Man.
So,
well, it's a fascinating topic. And I would love to have you back on at some point as we generate some more questions, because I I get that it's not going to be solved in a 20-minute interview, but I think that's a great high-level overview. And I just, man, it's so overwhelming as a business owner. It's so overwhelming to kind of, you see all the rhetoric and you see all the discussion, and it's kind of overwhelming to even know where to start. So I appreciate you kind of giving us a few pointers there, and at least where to kind of start to dip your toe into it. So Clay, I can't thank you enough. If y'all have any additional questions, please let us know, and we'll either follow up with Clay or if Clay's willing, we'd love to have him back on the show. Ask the expert. Anyway, so thank you again, Clay. And I can speak to this personally. There's not a lot of great people in insurance. Clay's definitely one of the best, or the best. Very, very honest man, and great to work with, as I can personally vouch for. So Clay, we really appreciate you coming on, and look forward to talking with you again in the future.
Thank you, Rhett.